After the hospital, I had to do rehab, and that was one of the things I was told before I was released from the hospital. And I had 2 sessions per week. I had one in the morning on a Monday, and I had one on a Thursday.
The whole cardio rehabilitation to me is very important, and I think why I'm saying it's important is because it's something that you control. You're not in the hands of a surgeon or a cardiologist who's doing doing an operation. The recovery aspect is something that you control and only you can control. And if you throw your hands up, then it's going to take a long time before you get back to feeling better.
You do track work. You do stepping up and down on a little platform to get your heart up and racing. You do a little bit of weight lifting. That's the first 6 weeks. Then you got another one to do afterwards, which is an intense one, which is 5 weeks of that. But it's only 1 day a week.
The camaraderie of people who, male and female, are going through it in various stages. Some of them might have only had stents. Some of them might have had massive heart attack. And everyone's got a war story during your 8 week of doing it. Some have finished and new people start. And then you're the one providing comfort to someone new.
They want you to, keep moving around, breathing, lungs, all those sort of things need to keep working. So it looks like doing things is a good, providing they're supervised and in line with what they recommend, doing those things is helpful to your recovery. And I wasn't so I was perfect in all of that, but I pretty much did what they said and still do to a large degree.
I'm supposed to do an hour walk a day, but I become a little bit lazy from time to time. But my brother forces me. If I don't do it, you're back to where you were, square one.
On discharge, the surgeon had a follow-up procedure in a couple of weeks' time to check, and I've been back to see him twice, and he admired his handiwork. And from the healthcare professionals, they have a duty of care also to make sure you're well, so that's the way they handle it, by seeing you and checking you and testing you to try and see if you're repairing as expected or if you have any problems on the way. Well, I think it's a bit like you buy a car and you keep it serviced as per the logbook, and hopefully it goes and doesn't break down. So if you follow that kind of procedure, you're doing the right thing by yourself.
Each individual is different. You might actually have 1 graft, you might have 2 grafts or 3. But for me it was 5. When I saw it and all that, it's like turned on a light for me. Before, I used to eat foods that I shouldn't be eating, like chips done in oil, fried, sausages like not cabanossi, but chorizos, which is high in fat. So, and cheeses I used to eat a lot. A dietitian said to me, "That is the food that will send you to your grave." And I said, "I've been there and came back." I said to her.
Weight control was important for me, yeah. And of course cholesterol, any foods that are added to the cholesterol, which is what causes the blockage in the end, are to be avoided. And from that point of view, we try and be careful.
The main thing I got out of having this procedure of the coronary bypass is I can walk a lot further, I can breathe more, I'm much healthier than I was before because I can do things I couldn't do before.
A little bit of restriction on golfing activities for a few months after the surgery, but that's only because of the cutting of the chest and the repairing of that wound, let it heal properly. And other than that, I haven't had much difference in lifestyle. I've kept a couple of kilos of weight off, which is good. So I've had a few new garments to replace the wardrobe, so that's fine.
If you're a bit overweight, especially if there's a bit of history, family history, and you like eating the foods that everyone's telling you not to eat, go and get these tests done. Know where you stand and you can manage it, and don't be a heart attack. Beat the posse.
If you're suffering from chest pains or any of the nature of short breaths, by all means get it looked at.
I didn't have any symptoms like shortness of breath or pain, so I didn't feel unwell. So having a blockage was a big surprise. So it just goes to show that how important it is to look after cholesterol levels and all those testing issues that might show up any problem rather than let them go undetected.
Moving from semi-retirement to fully retired was something we were looking forward to. Your lifestyle plans go totally on hold while you're going through this procedure, but now post-op, I've got a brighter outlook on life, and time to enjoy proper retirement for many years, I hope. Yeah.